Good afternoon, sir. Good afternoon, classmate. Today we are going to discuss about the cervical cancer. A quick recap about the anatomy of the cervix. So, cervix is a part of a woman's reproductive system. It's in the pelvis, a lower narrow part of the uterus or the womb. It is a passageway. For example, during menstrual period, the bloods flow from the uterus through the cervix going to the vagina, and it leads going outside the body. The cervix connects the uterus to the vagina. Cervical cancer is the third most common cancer in women worldwide, commonly caused by human papillomavirus or HPV. HPV is a sexually transmitted infection. Cervical cancer is a disease that develops slowly and begins with precancerous condition known as dysplasia. So what is dysplasia? Dysplasia is an abnormal cell but not a cancer. Pero sometimes it became a cancer kasi ang dysplasia ay nagkakaroon ng abnormal growth of the cell in the surface of the cervix. It is caused by sexually transmitted infection, the HPV or human papillomavirus. It is also a malignant tumor deriving from cell of the cervix uteri, which is the lower part, the neck of the womb, the female reproductive organ. There are several different types of cervical cancer. Most of these cancer are squamous cell carcinoma and adenocarcinoma. Adenocarcinomas begins in mucus-producing glands and are often due to HPV infection. Then, the cervical squamous cell carcinoma, a type of cervical cancer that begins in squamous cell of the cervix. Cervical squamous cell are found in tissue that lines the outer part of the cervix. They are thin, flat cells that look like fish scales under the microscope. Most cervical cancer are squamous cell carcinoma. So, these are the risk factor of cervical cancer. First is smoking. Because of the nicotine and other byproducts of the tobacco na pwedeng makasira sa cervical mucus ng mga babae na naninigarilyo. Research say na ang mga substance na nasa ating tobacco can cause damage sa ating DNA cervix cell na pwedeng soon magkaroon o pwedeng magkaroon or mag-cause ng cervical cancer. This may also weaken our immune system to fight infection or the HPV. Next is the weakened immune system. Because of having a disease or sakit na pwedeng makahina ng ating immune system, like HIV or taking a drugs that can suppress the immune system, this can cause a higher risk to develop a cervical cancer. Next is having a multiple full-term pregnancies. Meron din siyang risk to develop cervical cancer ng mga women with 3 or more full-term births because malaki ang chance nila to have many exposure to HPV infection by sexual activity na nangyayari. Long-term use of contraceptive pills. Because of the side effect of the oral contraceptive, pwede or possible ka to develop cervical cancer, lalo na if long time ka nang gumagamit nito. Next is family history. For example, si Marites, yung mother or sister niya nagkaroon ng cervical cancer. Pwede niya ito mamana or may chance siya na ma-acquire ang disease. It means meron siyang high risk to develop cervical cancer. Next is lack of regular cervical screening. Cervical cancer starts only by simple pain or because of unusual bleeding. Because of screening test, dito makikita or malalaman if infected ka, then pwede mo na agad itong matreat. So, early detection can resolve the problem. Dito sa cervical screening test, makikita if there is an abnormal growth na nangyayari. Diagnostic tests. Pap test or pap smear is a simple test used para tignan ang ating cervical cell. if there is an abnormalities na pwede ma-detect in early stage na pwede lumala if napabayaan. Nadedetect niya ang abnormal cell na it can lead to cervical cancer. According to studies naman, the pap test is not painful. Kukuha lang ng sample sa ating cervix, then they will check sa ating laboratory, titignan if there is an abnormal cell growth sa ating cervix. Next is the colposcopy. This use an special magnifying device called colposcope. This may allow the OB-GYN to see or to find a problem na hindi nakikita ng ating mga mata alone. The device can enlarge the view of the cervix. Next is the cone biopsy. So if the colposcopy is the visualization of the cervix, ang cone biopsy naman is the OB-GYN will get a sample sa ating cervix or pwede siya mag-remove ng tissue with local anesthesia. Then after that, they will send it to the laboratory to examine. Dito malalaman if there's something wrong sa ating cervix. So sa ating biopsy, there is a punch biopsy na tinatawag. It uses a sharp or matalim na bagay to pinch off small sample sa ating cervical tissue. Leaf diagnostic tests. This procedure can diagnose if there is an abnormal or cancerous conditions tayong nakikita. Loop electrosurgical excision procedure. The doctor uses an electrical wire loop to slice off a thin, round piece of cervical tissue. Endocervical curettage. The doctor uses a curette, a small spoon-shaped instrument, to scrape a small sample of tissue from the cervix. Some doctor may use a thin, soft brush instead of a curette. So, there are 4 stages of cervical cancer. In the first stage, the cancer is confined to the cervix. In the second stage, cancer at this stage includes the cervix and uterus, but hasn't spread to the pelvic wall or to the lower portion of the vagina. Third stage is that the cancer at this stage has moved beyond the cervix and uterus to the pelvic wall or to the lower portion of the vagina. In the fourth stage, the cancer has spread to the nearby organs such as the bladder, rectum, or has spread to the other areas of the body such as lungs, liver, or bones. Simple pathophysiology. Sexual activity. So the transmission of HPV is through sexual intercourse or during sexual contact. So during sexual intercourse, there is a possibility that the HPV will enter. So when the HPV enters, the virus enters in the basal layer of the cervix. So when the virus enters the basal layer of the cervix, the HPV infect the basal cell. So when the basal cell is infected with the HPV, the genetic material of the cell will be damaged. Then, when the cell is damaged, the cell will become precancerous. Then, damaged cell will continue to multiply. Then, there will be invasion or movement of the cancer cell from their normal location into the surrounding non-cancerous tissues. Means, the cancer cell enters or take over or being entered by force, then spread the virus to the nearby tissues. Then it will become cervical cancer.
Signs and symptoms of cervical cancer. Bleeding that occurs between regular menstrual periods because ang mga hormones natin ay naga-change, and use of hormonal contraceptive devices and infection or injury. Next is bleeding after sexual intercourse, douching or pelvic exam. Because sa pelvic or exam or sa sexual intercourse, our body, this section of the body is so sensitive. Next is menstrual period that lasts longer and are heavier than before. Because ang body po natin make the lining too thick, kaya nagkakaroon ng menstrual period na matagal at mas malakas. And then next is bleeding after going through menopause, because the tissue that lines the uterus can be very thin after menopause. Next is increased vaginal discharge. Because nagkakaroon ng increased vaginal discharge kasi it lacks oxygen, some cell may be infecting that tumor. And lastly, for the signs and symptoms is the pelvic pain. The pain can be as dull ache that may include sharp pains as well. Medical management for cervical cancer. First is the chemotherapy. So, ang chemotherapy is gumagamit ng chemicals or medication that destroys the cells. Cytotoxic medication prevents cancer from dividing and growing. Cisplatin chemotherapy drug is frequently used in combination with radiotherapy. Next is the radiotherapy, which also known as radiation therapy, works by damaging the DNA inside the tumor cells, destroying their ability to reproduce. Surgical management for cervical cancer. First is the laser surgery. It uses hit and kill abnormal cells. Ginagamitan po ito ng laser beam for 20 minutes. Next is the LEEP or the loop electrosurgical excision procedure. Itong surgical management na po ito is naga-prevent ng cancer cells at naga-remove ng abnormal cells from the cervix, safe and effective. Note, we should not put anything inside the vagina katulad ng tampons or the chest or having vaginal intercourse for at least 4 weeks after the procedure. Next is the cryosurgery. It uses liquid nitrogen to treat suspicious cells. Next is the hysterectomy or the pagtanggal po ng uterus. Nursing management for cervical cancer. First, listen to the patient's fear and concerns and offer reassurance when appropriate. Kailangan po natin makinig sa ating pasyente sa kanilang kung ano po yung takot nila or mga concerns nila dahil sa pagkakaroon ng cervical cancer. Next is, we need to encourage patient to use relaxation techniques to promote comfort. During diagnostic procedures, monitor the patient's response to the therapy. Kailangan po natin pakalmahin or gumawa ng pampakalma ng mga techniques para makapromote po tayo ng comfort during the procedure po na ginagawa sa patient with cervical cancer. Next is understand the treatment regimen. Next is give adequate fluid and watch for the complications related to therapy by listening to and observing the patient. Next is we need to monitor the lab studies and obtain frequent vital signs because po nagadeal po tayo sa health po ng patient natin and we need to monitor the vital signs because sa blood po kasi siya occur po and it may be affect the other parts of the body. Next is nutritional intake to promote tissue healing. Kailangan din po natin i-check or magbigay ng proper nutrition para maka-intake po tayo or mas mapabilis po ang pag-promote ng tissue healing. Next is explain any surgical procedure or therapeutic procedure to the patient, including what to expect both before and after the procedure. Kailangan po natin magbigay ng explanation or tamang pag-explain po kung anong gagawin sa pasyente of having the cervical cancer or mga procedures po na dapat po nilang maintindihan para hindi po sila mag-alinlangan. Next is review the possible complications of procedure to be done. Kailangan din po natin mag-review sa mga possible complications sa paggawa po sa procedure po na gagawin. Next is remind the patient to watch for and report adverse reaction. And lastly, reassure the patient that this disease and its treatment should not radically alter her lifestyle or prohibit sexual intimacy. Kailangan din po natin i-sure sa patient natin nga itong disease na to or ang cervical cancer na ito and yung treatment po hindi po siya makaka-alter sa kanyang lifestyle or sa kanyang ginagawa araw-araw or sa kanyang or sa sexual intimacy. And for the preventive measure for cervical cancer is the HPV or human papilloma virus vaccine. Kinakailangan po ng mga babae na magkaroon ng HPV vaccine in order for or to help or protect ourselves from HPV-related cancers and genital warts. Next is the safe sex. Sa safe sex po, kailangan po natin gumamit ng yung mga ng mga condoms, ganyan po, para ma-sure po natin na kapag nag-sex or nakipag-sex ang isang tao is safe po yun. Next is the cervical screening. Kailangan din po natin mag-cervical screening po para malaman if meron po bang mga possible na mga tumor po or may mga problems po sa ating cervix. Next is have few sexual partners. Para po sa atin, na kailangan po natin magkaroon ng isa lamang or few na sexual partners in order for us to protect ourselves po sa pagkakaroon ng cervical cancer. Because alam naman po natin ang cervical cancer is na nakukuha po siya kapag marami po tayong marami po tayong sexual partners at kapag yung isang partner po na yun ay meron cervical cancer and pwede po tayong mahawaan. Next is delay first sexual intercourse. Next is don't smoke because yung smoking po kasi is alam naman po natin yung mga byproducts ng tobacco na this substance can damage the DNA of cervix walls. Yung mga substance po na meron doon or mga byproducts po na meron sa tobacco po natin is ethylene oxide, benzene, or aldehydes. Kaya po, we should not smoke.